Welcome. This is Dr. S.D. Hess,
And I'm Dr. Ann Kirsch.
and we are on and off the spectrum podcast. Tonight we have one of my very special people and a very special guest for
Yes.
both of us, Dr. Patty Kerrigan. Patty, you and I have known each other more years than I think either one of us want to admit. It goes back quite a while. I was just telling Ann, we met at one of, I think, the original networking meetings way back when, in terms of just people were just establishing their practices and different ideas. And you shared with me this wonderful idea and the need for services for children who were recovering from post cancer of brain tumors, and the need for additional services, and this wonderful idea of a foundation that you were thinking about called ThinkAgain Foundation. And so we're hoping tonight that you'll tell us more about what was the impetus to starting the foundation, a little bit about your history, where this wonderful name comes from. And
Yes, I'm very curious about that. I've been trying to figure out what it could be. So, yes, tell
and
us everything.
and where the work is today to follow up, because I know our audience is interested in. So without further ado, Dr. Patty Kerrigan.
Yes.
Thank you, Esty. Nice to meet you.
Nice to meet you.
And um, uh, how did I start? I don't know. It was a long, winding road. I was a special education teacher in a psychiatric hospital in Chicago, and it was Children's Memorial Hospital. It's now called Lurie's. And while I was a teacher for the inpatients in psychiatry, we also had two little kids that were being treated for cancer, and they were immune suppressed. So they would take a cab to our classroom and go to school with the kids that were psychiatric patients. So we had these two little kids in our class. God, this is probably 30 years ago. And I noticed that the two kids who were both being treated for leukemia had unusual learning styles. They had a difficult time recognizing sets, like on a dice, you see 3 and 3, instantly you recognize that's 6 and 4. So I called a friend of mine who was in graduate school at the time, and he was studying pharmacology. And I asked him to look up leukemia treatments for kids and see what medications they're taking. And he called me back and told me about methotrexate and the effects of methotrexate on cognitive development. And it just kind of stuck with me. And then I made the move here with my family to Los Angeles, and I started to work in the psychiatric hospital at UCLA as a special ed teacher, same job. And I just had so many questions about the mechanisms of learning disabilities. I was so curious, especially for post-birth insults to the brain that could create learning disabilities like chemotherapies. So my senior teacher suggested I go back to school. So I got my PhD at UCLA in special education, psychological studies and education. And I was trying to figure out how I could use that knowledge I had about methotrexate in a study. But in order to do the study, I needed like 375 kids that were treated for cancer, and that was almost impossible. So I ended up studying spina bifida. But then a friend, my son's friend, had leukemia, and it just hit me again that I need to study this. So I started working in the cancer clinic at UCLA, in the kids' cancer clinic. This has got to be 29 years ago. And because I know that they needed help, and I was interested in that population. And as I was doing the work, I didn't do much research because there was so much clinical work I needed to do with these kids. They all needed help in school. A lot of them had learning disabilities. A lot of them had needed like cognitive rehabilitation and educational therapy. So then I thought, oh, I'm going to be an educational therapist. So I started to take those classes, and I was like, what am I doing? I'm like, I can't do everything. So I stayed working in the clinic, but I found that a lot of our kids weren't getting the services that they needed, specifically educational therapy and cognitive rehabilitation for these new learning disabilities that they had. So I remember taking a school district to court to try to fight for a special school for this little girl who had leukemia twice, a bone marrow transplant, and she was a sixth grader reading at a first grade level. And she was just devastated. And she had said, her mother told me through an interpreter, she doesn't want to go to school anymore, and she wishes the doctors didn't save her. And I was like, oh my God. So after spending a week in court with this school district and not really winning, I thought there's only one way to do this, and that's if I start a nonprofit to pay for services for these kids. And the Think Again is to help them think again, like think the way that they normally could think. And it was just a play on words, and a friend came up with it. And I said, is it available? So it was available, the URL. So I grabbed it, and it's now 18 years later, I think.
Wow.
I know.
2007, I filed. 2008 was our first active year. So it was a long time ago.
Yeah.
And we've expanded, as Dr. Hess knows, we've expanded to include brain tumors and also kids who have hematological disorders and have gone through bone marrow transplants, because that's also invasive to development. I've expanded beyond cognitive rehabilitation and educational therapy to also include occupational therapy, speech and language, whatever the child may need. I did have a brain cancer patient, which is what moved me into things other than educational therapy. Emmett, he was great cognitively, but he couldn't walk. He had right side hemiparesis. He couldn't get physical therapy. And his mom said, we'll refinance our home. We'll do whatever we have to get him therapies. And I said, don't you worry about it. We'll get him therapies. So we got a physical therapist to go visit him at his home and work with him. And he's now in college. So they don't all need cognitive corrections. They need physical and everything else that comes along with it.
This reminds me so much of a dear friend of mine whose son had leukemia, and it's the same story. She had the resources to bring in the best people, but it was the same time 30 some odd years ago, and there was nothing available. So here she could pay for people to come to her home and help, and she couldn't find anybody to do that. And you weren't doing this yet, I guess. So
I don't know anybody else doing it, and I wish more would take it on.
It's such a wonderful piece, and I will share with you as
beautiful
as one of, I'm sure, many mental health practitioners who you tapped to work with these wonderful kiddos and their families, the processing of the trauma of having cancer.
That's right.
And the inability to do things that they once had been able to do, or the parents' recognition that the child was, sitting at death's door as they interpreted it, or and it is such a powerful experience to be with these courageous families. It is unspeakable. These kids have a courage that is it's indescribable and contagious, which is wonderful too.
And parents will often say to me, I've worked with many, mostly teenagers. I was telling Esther, mostly teenagers and above, although a few youngsters who have had cancer and been referred. And I remember a couple of parents saying, I would have given up, except my child hasn't given up. That's how strong they are. And it is a remarkable thing to work with kids who don't give up. They don't know that they can give up in many ways. So it's just what what you're doing is just, and what you've done for so many years. What has there been a toll on you? Because this is not easy work.
um, yeah, I don't find it difficult. There are some situations where, like if we're going to lose a patient at UCLA, that's of course always difficult. But there's also some, I don't even know how to say this, some joy in it, even in that end stage, to see that family together and the love. And I really feel fortunate that I get to see real life like this,
It's true.
and to see the fight and battle and the strong kids, and it always just regenerates. Like when we had our bowling event, we do an event annually. It's Bowling for Brains. We had 153 bowlers, and we cape the kids. We have all the kids come, and we put capes on them, and it just re-energizes me to keep doing it. Sometimes the hardest part is raising money, of course.
Yeah.
And I'm not a fundraiser. I'm not that good at it. And I'm great at my job at UCLA and getting the kids what they need, but I'm not a great fundraiser.
You're
And
a clinician.
yeah, and
Yeah.
that's the hard part.
I have to tell you, though, I will compliment you because I've seen you working as a fundraiser, and I know the gifts that you've done to these families. It's absolutely enormous. I was actually wondering because over the years, I know we've mutually worked with some wonderful families. Are there any children besides Emmett who touched your heart, their stories, for a particular reason?
Oh, well, you worked with Caitlin. Caitlin's adorable.
Yeah.
And Alana, you worked with Alana.
Mm-hmm.
Dr. Hess works with some of my more difficult cases. And when we need developmental psychology intermixed, and that could be what's keeping them and what's the hurdle that they need some psychological work.
Right.
I call her in when there's some dynamics there that are getting in the way of them achieving things. We had, I can't think of her name now. Remember the little girl who didn't speak, selective mutism?
Mm-hmm.
And I sent her to you for speech, but you saw her for psychology, and we finally got her through and working through all her psychological issues so that she could speak.
Yeah.
And she had a difficulty with her sense of self in her space. So she needed occupational therapy, balance issues. And Dr. Hess was kind of the go-to clinic where I could get the speech, the psychology, and the occupational therapy all in one place.
Mm-hmm.
So that was really special.
Were any of these children kids that you knew of ahead of time who had difficulties, psychological, emotional difficulties, and then that made the treatment of the disease and afterwards even more difficult?
Well, yeah, when the first time you meet them and I usually try to get a little bit of history the first time I meet them, letting them know they're going to be out of school for a good year. And I ask a little bit about how things are, and you get a feel for the family. The whole family's there: mom, dad, brother, sister, and you can tell the temperature in the home. Sometimes you can tell this kid's going to have a hard time. If mom's having a hard time, because the child generally looks to the mom for guidance on how to feel about things.
Sure,
and if she's not doing well, they may not do well. And if they have like learning disabilities before, we have some kids with autism who come with a diagnosis, and then it's going to be challenging, with treating them. But you could, if they have pre-existing learning problems, and then they have the radiation and methotrexate and vincristine and all those chemotherapies on top of that, you're going to have a more affected child. Yeah. And it's going to need a lot of work. So we try to sometimes do therapies during their treatment, a lot of physical therapy for some kids. especially if a child might have graft versus host disease, and it might affect the skin, so they can't stretch.
Right.
So if they don't stretch their arms, it's going to like stick that way, stay that way, and it takes a lot of physical therapy to try to loosen that up for them.
Right.
But I'm getting off topic here. But
No,
yeah, you can
that's
generally
fine.
tell pre-existing conditions and
We need
how
a
the
lot more
family is.
clinics around, like what Esty does and what you're doing. There needs.
Yeah.
I've always felt that a lot more
Yes.
people who you can call them.
Actually, that's a thought. I mean, I know, for example, Patty, when I travel and speak around the country or internationally, people always say, can you franchise yourself out? And, wouldn't it be nice if we could subdivide us into different cubes here? But have you ever thought this is such a needed service to expand and certainly create something perhaps on the other side of the country?
No.
No. I don't want to give you more.
Yeah.
Okay.
I'd like to find somebody who's already done that.
Yeah.
Right.
I did meet a woman who I recently honored her at an event. Her name is Lynette Lascala, and she founded her son when he was 1 year old, drowned and then was brought back, but was kind of vegetative and in a hospital bed, and the doctors basically said that's how he's going to be forever. And she didn't take no for an answer, so she traveled around the world and found therapies and brought those therapies to a place called NAPA. It's Neurohabilitation and Physical, I don't know what it stands for, but it's NAPA Center, and it's right here in Los Angeles, was the first one. And she's now has franchises all over the world. She's in Australia and England, Colorado, Chicago, Boston. She's got NAPA centers, and the NAPA Center does physical therapy. It's a lot for near drowning kids. Her son was up and walking and talking, and when he was 11, he had another neck surgery though that put him back in a wheelchair. But he's living on his own now in an apartment. He's disabled, but he has accommodations. He's probably 40 now. But she started this program. So these programs do exist. I had never heard of it. I was happy to find it. And it's usually for like kids who have near drowning or brain injury or cerebral palsy. And it's like they have chiropractors, physical therapists, occupational therapists, speech and language, feeding therapy. It's for the more severe kids. But I was happy to find that because I've had some very affected brain cancer kids, and that needed to go to her. But not too many are that severe. We've come a long way with cancer treatments, and it's not as severe as it was when I first started this work. Overall, we have 85% survival rate in kids' cancers, which is phenomenal.
Amazing. Absolutely amazing. Yeah.
Yeah, and it's great. So
I will
not
tell
all
you,
staff.
I have always actually been so taken by how much you're loved by the physicians who you work with. Because
By how much what?
That you're loved by the physicians,
Oh.
the docs who you're working with, because I think they themselves know the need. They know that on some level, it's so funny. I liken this to there was we all were watching Spellbound. There was a little girl, remember, who fell into a well, and the fellow who had to rescue her said that, okay, I am hesitant to pull her out, right, from the well because I think her name was Jenny or Jennifer or something.
I don't know.
And because I'm afraid of breaking something. And I remember the doctor behind him says, whatever you break, we're going to fix. Just get her out, right? And I had that image of you behind the doctor going, okay, go ahead, break what you got to break to survive, and we'll fix it. We'll fix whatever you got to break. Just get them out, And this is it. But I have been really impressed with these wonderful doctors one after the other give you a hug at these wonderful fundraising events to say thank you, because I don't think they know that their work is not done when they hand over a child who is okay. We're movement into recovery, but there's still so much to do.
Right, exactly. Yeah. And it's unfortunate that some of these insurance companies won't cover things, and
yes,
or they'll cover once a week, physical therapy, and that's not enough, so I'll double it or triple it, or there'll be just copays. It depends on the family. If the family's financially and stressed, which most of them are, because one parent usually has to stop working in order to take care of this child at home. So there's always like a financial burden for these families, because they have to pay for parking and they have to pay for hotel rooms and they everything else. But sometimes it's just copays, and some of the families are thrilled. I'm covering their copays, and I'm like, it's such a little thing, and they're like,
but it's such a big thing
for us,
because it's one thing off the list,
right?
And it's a lot. It's a lot of money.
Yeah, eventually, with everything adding up, absolutely.
So, yeah.
Do you see? I mean, at this point, after doing it, as we talk about, more years than we care to actually add up, what do you see in front of you in terms of the future of the foundation, and what do you hope to leave as a legacy for yourself and maybe for the next generation?
Well, I hope to. I hope there's enough money in it to be able to turn it over to maybe a bigger umbrella organization like Pediatric Cancer Research Foundation or something like that, or Leukemia and Lymphoma Foundation, or it's funny. People talk about St. Jude and they have so much money, but I've taken care of some of their patients, because like I'll get a referral from a St. Jude's patients where they'll just be treated for the cancer but nothing else. So then I take over and help those kids. And I thought, well, St. Jude's, it would be nice if they had some follow-up like that. So, maybe, who knows? I have a board, and I've already discussed with a couple board members, if something happens to me, this is the bank account. This is how you take care, do everything. And I think they'll keep it going, with enough people working that are involved in it that also work at UCLA. I think it would keep going. I don't care about my own legacy. I just want to make sure that these kids get the care that they need, and that there might be some money there. We'll see.
Those kids are
if I can keep it going. Yeah. But we'll see.
Yeah. Wow.
Well,
this is so touching.
It has been a gift for myself to have a relationship, Patty, with you, and to see the selflessness of your energies. It's just about helping the kids.
Thank you.
No, truly. I mean, hats off in every possible way. And jokes aside, we all know it's really hard to fundraise, but you do it with a smile, and for the kids, and that's very obvious. And I've helped, because of you, countless families to believe that there's going to be another day and many more tomorrows for their children in a very positive way. So as one clinician to the other, I thank you in this context of working together.
Well, thank you.
But I also want to thank you for being on tonight's podcast. It's exceptional, because we're here to offer parents some direction and tips, and above all else, I think hope. If they hear a devastating diagnosis from themselves or their children, and if I can imagine when a parent hears the word cancer and their child is at stake, and not knowing from one moment to the next what direction is, and then, oh my goodness, there's so much more past recovery, and you have and continue to offer them hope. So it's been truly an honor to showcase your foundation this evening, and I want to thank you. And I'm Dr. Esty Hess.
And I'm Dr. Ann Kirsch, and it's just a pleasure to meet you and hear what you've been doing for the past 30 years.
Thank you.
This has been
And Dr. Hess, thank you. I want to thank you
Oh,
for being there
oh,
for so many kids that I didn't have any place else to send them except to the best. So I
thank you.
sent them to you and to take care of them. And
This
I
is
can't
a
say enough
mutual
about you.
this is a mutual hug.
Yeah.
That's what and I appreciate that so much. But this has been on and off the spectrum. And to our viewers, if you've enjoyed tonight's episode, please continue to tune in, to share, to subscribe, and to follow us on all the social media platforms that you'll find on and off the spectrum podcast. If you yourself think you can add to the story and want to be part of a future episode interview, please don't hesitate to reach out to us. Until then, we wish everybody a wonderful good night and a safe evening. And Patty, again, much thanks.
Thank you. Thank you. Have a good night.
You too,
Thank
please.
you.
Bye-bye.
Bye-bye.